Hey there, it's Andre, the Impulsive Thinker. Today I have Dr. Russell Ramsay. He's joined us again to discuss CBT therapy for ADHD, so cognitive behavioral therapy. So, Russ, thanks again for joining us.
Andre, thanks for having me back.
Last time you were on, we talked about anxiety and ADHD, and I know everyone learned a lot, and I appreciate your time on this. And we were in the green room talking, and we talked. You mentioned something about modified CBT, and I think my words were, I thought CBT was a complete waste of my time when I first got diagnosed with ADHD, and you kind of said, "Yeah, makes sense. Why does it make sense?"
Right,
Oh,
right. Yeah, no, and I shared the example when I arrived at Penn when I was a postdoctoral fellow getting excellent supervision and training in cognitive behavioral therapy. And I had come there with a good background that like the standard approach, it started as a therapy for depression, got pretty easily modified for anxiety and a host of other things. Um, so before I had ADHD on my radar screen, or before we started the Penn Adult ADHD program, I had not even met my collaborator and co-author Tony Rostein yet. I had a client who was diagnosed with ADHD, not by us, because the Center for Cognitive Therapy's initial evaluation, as most do not include any reference to ADHD, but came in with a history diagnosis. And I was dutifully doing my CBT protocol that I had done well with many other clients and talking about his procrastination. And he said, I know what I need to do. I'll probably, yeah, but I'm worried I'll procrastinate. And I'd say, okay, let's deal with that negative thought. And let's come up with it was done more tactfully than this,
yeah,
but let's
yeah.
come up with a replacement thought. Okay, that you can give it a try, get started and get it done. Okay, go forth and do, and let's touch base next week. And he came back and said, I could tell I was procrastinating. I changed my thought, but I still procrastinated. And I knew I was procrastinating as I did it. So, I mean, that's just one very small example, maybe
Hmm.
exaggerate a little bit for effect, but probably not too far from the truth.
Well, for me, it was, well, before we get too deep into this, let's explain CBT a bit. Sorry, I really got into it right away.
Oh, no, no. Well, in a nutshell, now cognitive behavioral therapy, um, what it brought to the table in terms of psychotherapy at the time was the emphasis on cognitions. There was behavioral therapy, but behavior therapy treated thoughts and beliefs as like the black box in the brain. We don't understand them. And our thoughts are like any other behavior that can be shaped. So we're not going to worry about if you think you're a bad person, changing that thought. It's like, if we can get you doing these things better, that behavior will also change. But Dr. Beck's wisdom was, and from his experience with clients, saying they often held mistaken beliefs, even about him in session. Like he noticed
Yeah.
one woman, her face changed, and he asked her, breaking what he said, he was a trained Freudian. He broke the Freudian mold and asked her, what thought went through your mind? And she said, oh, I thought you were upset with what I just said. And he said, no, I'm not upset. I was just leaning in and concentrating what you were saying. And it got him thinking, I wonder if my other depressed clients have these sorts of negative interpretations.
Mm.
One thing led to another, and that piece ended up being very influential. It doesn't ignore behaviors, it doesn't ignore emotions, it does not ignore history, but the focus is on, all right, that history, how does that affect your belief system? And how do those
Right.
beliefs affect how you interact to day-to-day things now? And that by changing your thought, you might change your emotion a little bit. Yes, by changing your emotions and behaviors and doing things differently, you can test out these thoughts and change them that way. But it became this part of CBT. And then there's others within the behavioral therapy, close cousins like acceptance commitment therapy, dialectical behavior therapy
Hmm.
that integrates some other mindsets. Like ACT comes from a stricter behavioral analytic model, and DBT has the focus on emotions. And it started with people who
And
self-harm,
mindfulness.
and
Yeah.
there's actually more of a movement now called process-oriented cognitive behavioral therapy that is like a meeting point of all these things.
Huh.
Really
Interesting.
the integration right now, and that's sort of like cutting edge right now. But they all come from the same family and different emphases. And I think truly clinicians, hopefully good ones draw from each of them, even if like I define myself as CBT, somebody else DBT, but there's things to learn from all of them. So, and DBT, Alexander Philipson in Germany adapted dialectical behavior therapy for adult ADHD.
Yeah. And I think that's the key one. It has to be adapted because like what I
Yeah.
recall from the CBT, like I learned a lot. I just
Mhm.
didn't think it helped me fix a lot of perceptions I have. So just kind of what you were talking about before, if you just kind of visualize a triangle that says core beliefs, that's our core beliefs. And circling around that at each point is we have thoughts, the
Mhm.
feelings about the thought that actually affects or adjusts our behavior. And it's a constant circle. And that kind of
Mhm.
builds your core belief.
Yeah. Yeah.
Yep. And then
And well, that's like the experience of living with ADHD though creates, and it's more about the executive functions
right.
that many of the things that we're expected to do. I'm sure there's cross-cultural differences in education systems and things like that. So there's probably cross-cultural differences, but generally those experiences are like sort of the X factor that
Mm-hmm.
classic CBT. Now, I think the executive function model should be should be taught in graduate programs in psychology, because I find it very useful with clients I work with who don't have a whiff of ADHD. But in
Right.
terms of depression and getting
Yeah.
active when you don't feel like being active, or facing your fears with classic anxiety, but that executive function model, how that affects experiences, that affect the thoughts, that affect the emotions, and then having the executive function workarounds, rather than working harder and harder to not procrastinate. Like one of the things that we do with our CBT model is reverse engineer procrastination. And
Mm-hmm.
I won't bore you talking about the procrastivity, but we reverse engineer procrastination into specific action points or pivot points.
Yep.
Like, let's look at the thoughts, how you psych yourself out about a task beforehand and change those thoughts. Sure. Let's understand the emotions. Our last time together, we were talking about anxiety and how,
Yep.
okay, being anxiety free or discomfort free can't be a precondition for getting started on things, because there's a lot of things you'll never want to do.
Mm-hmm.
But can you tolerate the anxiety and bring it down enough, the discomfort? And then how can we set up actionable behavioral steps, the proverbial break things down, but let's actually do that. So we get it down to a point that you go, yeah, I can at least log on to the manuscript and reread the last paragraph I wrote yesterday. You haven't produced anything yet,
Yeah.
but you've just exponentially increased the likelihood. Okay, looking at it now isn't as bad as my imagining how bad it was going to be, and how that imagining affected my feelings. And the imagining comes from past experience. But now, if you could imagine 50 different experiences, but now you're facing one, and at least it's a fairer fight, and you have a chance to more
Yeah.
often make some progress.
Something you said a bit earlier. Now you said about the executive functioning, and
Mhm.
the other thing in DBT I recall is when we have these thoughts before it becomes a feeling, we're supposed to catch it,
Mhm.
check it, and then change it, right?
Yeah.
But when you start talking about executive functioning, I think a lot of my thoughts was about I can't do that. But it's
Yeah.
not really a feeling or a thought to catch. Yeah, it's not a thought that became a feeling to become a behavior. I physically could not do it. And to me, maybe that's where I got my little disconnect is I'm not really excuse me, dealing with a behavior thought. It was actually
Mhm.
a performance thought. Does
Right.
that make sense?
Yeah. And even working through things like that with clients, sometimes that's the first question. Like one of the thoughts I'll hear people say is, let's just say it's a student about to write an essay. And they, even talking about, sometimes the first step could reread the syllabus just to make sure you know the actual due date that
Mm-hmm.
you say it's a 10 to 20 page paper. Maybe it's a 5 to 10 page paper. And I've had that happen where they're psyched out because it's 20 pages, then it's 5 to 10 pages. And it's like, oh, I procrastinated for a week thinking it was that, but I misread it. But bringing it back to, somebody might say, I'm 99% sure the topic I'm going to write about is what the professor's looking for, but that 1% is keeping me from starting, because why would I want to sit down and write if I'm going to come up with 5 pages and find out that it was not the right thing? Now, the solution seems logical, but this can be the emotional overwhelm of I just gotta wait till later. I'll figure it out
Right.
later. And if you do, that's fine. But then the task becomes, can you reach out to the TA or the professor and run it by them? That becomes the first step in the task before even writing, because that's the barrier. That's the performance barrier. So yes, these performance things, and even stuff like, yeah, but I'm not good at writing. Okay. And I did this one time with the person's permission. Um, Tell me out loud Just don't worry about writing. Just say what you want to write about. And this one time with this student, with their permission, I recorded them and gave them the recording. And they said, wow, now it's never easy, but that was the easiest paper I wrote because I could listen to what I was saying and type down some of it. And that got me started because sometimes from our brain down to our fingertips and holding on to it and typing it out, that
Doesn't
delay,
work
there's a
well.
lot of things,
Yeah.
but we're more talking. We don't have to learn to talk. We learn to talk unless there's some language problem in the culture we're raised in, but writing, you have to be drilled in. It's unnatural.
Right.
So if we draw on that, talking aloud, voice to text software, or in that case, the client telling me and talking to ourselves and then transcribing it. Tell the dog what you want to write and then transcribe it.
Well,
it's a way to get unstuck with emails and stuff like that.
That's one of the things I tell high achieving entrepreneurs to do. ADHD entrepreneurs, even for myself,
Right.
like I started to delegate by going to Otter AI. Just for some
Yeah.
reason, the head to the typing does not work well. To me, it takes too much thinking or processing. And the other thing I was reading, and I'm agreeing with this, I can't process stuff in my head. It has to come out for me to hear it or see it for it to figure it out. And I
Right.
just tell people, just talk out loud.
Right.
Record
we talk about,
yourself.
we talk about multiple ways to present information in the classroom, like talking to ourselves. We have to process it. We have to say it, which is motor.
Mhm.
And then it comes out. So we formulated some words and then we got the auditory system where we hear it. And that, I'm not saying it's magic, but then that also helps
Makes it easier.
it drives the focus into,
Yeah.
okay, I'm hearing this thing and I'm saying it, I'm hearing it internally, I'm hearing it externally. So that is dominating, at least some senses, where in a healthy way, it might crowd out some of the other things that go, yeah, bud, is that good enough or whatever? And it's
Yeah.
more like we can get it down.
I kind of get the sense when I hear it, then all of a sudden other parts of my brain connects the stuff and then says something else. And, a lot of times I don't even know what I'm about to say, but it comes out, it makes sense.
Right.
But
Right. In a way, this could be an overselling of it, but it would be in a way, a grounding experience.
Yeah.
How sometimes people will, like people with extreme anxiety, and we'll talk about being grounded, like cycle through the five senses or
Mhm.
feel the arms of the chair you're sitting in, get in
Right.
touch with the here and now and get out of your head. In a way, that's what that's doing to sort of focus the attention and use the auditory system too.
So you did an example about the student there. And the one thing that was hit me is like the example of not getting your homework in on time. We can use that.
Mm.
That's the actual problem, actually. But if you want
Yeah.
to do it in the CBT sense, the question would have been asked, well, how did you feel? Well, the thought is I'm actually stupid.
Mm-hmm.
How does that make you feel? Very sad. So let's change. What was that third one? The behavior, but actually it's not a
Right.
behavior I need to change here. The fact is I couldn't get my homework done. That caused the stupid feeling.
Right. And it's not from lack of knowledge. It's the disorganization. I don't know where to start. I know all the pieces, but I don't know how the pieces go together.
Right.
I think we talked before about the fancy phrase of breaking down tasks into small steps, but there's the event segmentation, which is the breaking it down is the fancy phrase, but then the sequencing. And that's
Mhm.
another problem because that's a working memory issue. And think what writing is: sequencing of words, sequencing of sentences, sequencing of paragraphs. It is a sequencing nightmare in a way.
Yeah. So I think like a lot of like when I was in the CBT, like I had a lot of behavioral maladaptive behaviors because of the undiagnosed ADHD and also the life tempest I was having at the time. So it helped for a good portion of it for the behavioral stuff, but there's still that one piece missing.
Right.
And I think is what you're explaining, it's the more the executive function, the ADHD side and the performance side. So you mentioned something about modified CBT. Can you explain a little more about what that would be and what it would look like?
Yeah. And another way you might hear it is CBT adapted for adult ADHD, because with depression and anxiety, it started off as a therapy for depression, then anxiety came pretty close after. And those, anxiety and depression are like the common cold are to medical practice. Everybody gets trained in it. So even though anxiety thoughts and depressive thoughts can be somewhat different, they're sort of related, but, anxiety has a theme. Depression has a theme of loss, and it could be loss of esteem or opportunity. Anxiety is more about uncertainty and, the risk that comes with that. Like with ADHD, like you said, it's more of a performance problem, not a knowledge problem. So you could come up with the best reframes. So the adaptation of CBT for adult ADHD really focuses around the one, the executive functioning workarounds.
Mm.
What are ways that the skills, and there's no trade secrets. Everybody knows what they are. And, I would often still hear people say, well, if I could do all the things you're asking me to do, I wouldn't need to come see you. Use a planner, get started earlier. But I think it is a breaking down, not just with the therapist, but, figuring out how to do this. And there could be worksheets and other things, which again, it's more work to organize and things like that. But hopefully there's a muscle memory that comes with, all right, let me understand how I don't do things and look at these. I just call them these specific pivot points. All right, how am I thinking about what I'm going to do before I try to do it?
Right.
Let me have a plan that's realistic. And realistic for me, what's realistic for somebody else? Somebody else can have a broad, vague, non-specific plan. I've got to catch up on homework. And the neurotypical person may go, okay, I'm going to start with history, then work on the paper for a little bit, then do my economics problem set. Somebody with ADHD will get frozen there saying, okay, I got to do homework, but where do I start? If I do this, I'm taking time away from
the
that.
Overwhelm
And
freeze.
and I'm putting words on things that can be very automatic, visceral, cognitive processes, and not cognitive necessarily thinking, like working memory and executive functioning cognitive. So, actually getting practice with breaking things down, finding out what your pacing is, what your energy load is. Are you a person who needs or works best with 20 minutes on, 10-minute break? Or can you start, I can go 45 minutes first, then 15 minutes, then 30 minutes, 10-minute break, personalizing it, but using the skills for the workaround. Yes, that may include a planner of some sort. Obviously dealing with procrastination for my money is a big thing. But having the things personalized to you and your executive functioning, one person could do well with a digital planner. Somebody else color codes it. Somebody else I just need one sheet every day. But I'm a big believer in equifinality. There's different pathways to get to a similar good outcome, be it a planner or dealing with procrastination. So that's the personalization of ADHD. And the executive functions have been the main adaptation to the classic CBT that didn't directly factor that in at all.
And that's what I tell everyone. Your ADHD is different than mine. Like someone was telling me, if you saw one person with ADHD, you saw that one ADHD. So,
and I want to jump back to something you said before about like getting a therapy for depression or anxiety can help a little bit. And that can the same thing with medications. It's like reaching this plateau where it's getting better, but there's still something else there. And that can also often be the missing piece in the diagnostic puzzle before there's the accurate diagnosis of ADHD. And I think women were particularly prone for this with the difficulties either being self-diagnosed as anxiety or depression. And it's not wrong. It's just incomplete. Or maybe that was the diagnosis conferred upon them by, I say this respectfully, with somebody who may not have been trained in ADHD, because I wasn't. I had no training in ADHD before I started the ADHD program. So I'm like one of these people who now I'd have to go through. I don't know if I'd make it through now, but I think just got to write some of the stuff.
And it's one thing I want to make sure for sure is we're not shitting on the other people.
No.
It's just, you only know as much as you're taught. And if the system just teaches you the one CBT, it's very hard, and we're not giving the people a rough time that they didn't get extra education of ADHD. But I think everyone has their own specialty too, right?
Right. And I want to share a story quick because it's always being updated with the new science. And even Dr. Beck, who passed away, I think it was November 1st, 2021, at the age of 100.
Wow.
But he was, he started in his late 70s when I started at Penn. A recovery-oriented cognitive therapy for schizophrenia, for which there have been very few psychotherapies, and it's now an evidence-supported treatment. And one of the core themes for individuals with schizophrenia was defeatist beliefs. And these are people who had been hospitalized for a long time, like, I can't do it. And part of the focus on the cognitive therapy was building up strengths and resources and positive thinking. And even later in his life, I heard, from his daughter, Judy Beck, a very internationally renowned psychologist in her own right, that he even thought back to depression saying, I wonder if I might have missed something. Maybe I emphasized the negative thoughts too much and we could have added in more. So he was always editing up to his last breath. So it
Okay.
is not meant to be, hey, this is fixed in stone and this is the way we do it. Yes, there's a framework, but it's always adapting to the science. But ADHD has been one of the big
Yeah, it's
adaptations.
not an
So,
exact science. And
mhm.
it's like engineering. Every time when something breaks down, we figure out why and then
Yeah,
adjust and do the design next time. And that's a very
right.
good point to also make, Russ, because we're learning so much about the brain and mental health lately.
Oh
It's a
yeah.
constant, it's very new, honestly,
Oh my
compared
gosh,
to other
when I was
stuff.
a kid, I'm a Gen Xer. When I was a kid in grade school, after you come in from recess on a hot day, you were told you don't want to drink too much water too quick.
Yeah.
That might not be good for your stomach or something. And now we know by dehydration,
Yeah.
it was like the total antithesis, but that was the going wisdom of the day.
So if I'm interested in getting CBT, and it's in a group setting, correct?
No,
No?
there are group approaches for CBT,
Okay.
for ADHD, but also a lot of it is done individually, and even some of the group approaches can be modified for individual, just like individual could be modified for groups.
Yeah. Like for me, I was in a group
Okay.
CBT, and I thought it was really nice to hear other people's struggles and their
Yes.
fixes.
Right.
So there's a sense of community, yeah, a
Yeah.
little bit of a community, but
Right. Right.
helping each other out really helped me.
Mhm.
So if you're diagnosed or not, or prescribed, or you want to do CBT, what should we be looking for in the program?
Well, it's asking for somebody's experience with ADHD and whether they do assess that. It's not necessarily that they do diagnostic assessments, but it can
Hmm.
be helpful. And especially if that's what you're looking for too. I don't know if I have ADHD. I think it is, but will you assess for it during the intake evaluation? And we've had, when I was at Penn, like 20 days ago, no, but we would have people come through where we go, you know what? This isn't ADHD. You're having attention problems and there's some disorganization.
Yeah.
Our approach, our CBT approach can be helpful, but we can't call this, we wouldn't be doing any service calling this ADHD. So it can be helpful for like, other people who are having performance issues. But what you're looking for is, questions like how familiar are you with, is there a particular protocol? Do you use the Harvard Safran Susan Spritch approach? Do you use the Ramsay approach, the Mary Salanto? What ones are you familiar with? And there's some workbook, and many of these, like I think with Mary Salanto's book, the workbook, the session by session is embedded in there. For the Safran, it's the Safran manual is in its second edition, both the therapist manual and the workbook.
Right.
Ours is in a second edition. We don't do a session by session approach, but our toolkit is our client guide, if you will.
Hmm.
And there's some others I'm sure I'm forgetting right now, but you can just ask around. Also, you can reach out to ADHD programs. Now, the Penn program will not be going on since I left. The department decided not to maintain it, but you could reach out to me. Duke University has a good program. Going through like CHAD, ADA, and APSARD, the American Professional
Hmm.
Society of ADHD and Related Disorders, looking at the professional advisory board, they may not be able, each one of these people may not be able to provide it, but if you reach out and say, anybody provides CBT near
Yeah.
where I am. I don't think there's a good clearinghouse right now, but
No.
Chad and the National Resource Center do a really good job, and ADA is another resource. And
Yeah.
just reaching out to people who've written things. Ari Tuckman outside
Yeah.
of Philadelphia
Yeah.
is another world expert and a good guy. I mean, he could be a wretched guy, but he knows what he's
Yeah.
doing. But
Yeah.
he happens to be a great guy. Yeah.
And the other thing too, like in Canada, CADAC, the Center of ADHD Awareness
Oh,
Canada, has great
that's right.
resources. CADRA,
Right.
the Canadian Alliance of, I forget, but that's the
Yeah, I
doctor
remember too.
research side.
Yeah.
I
And
know
Lily
Australia
Heckman up
has it,
there. And
UK, yeah.
yeah. Oh, yeah. And there's a lot of good people up there. Yeah.
Yeah, I think, yeah,
Martin Katzman in Toronto has a wonderful
yeah.
program. Yeah.
So yeah, any country, UK, Australia, I think you'll have a resource somewhere. And I think probably the best place to go there and see what recommendations
I've got a couple reputable sites on my website if you want to go to it, like
Yep.
for the UK, the Canadian one, and some of the ones in the US.
Okay, and that's www.cbt
Correct.
for the number
Number
4
4.
ADHD.com, and I'll put that in the
Correct.
show notes for everyone to be able to
Great.
find it,
Sure.
and your email address. So that was very nice of you.
Yeah.
So I guess the takeaway here is for us, if we're going to be looking for cognitive behavioral therapy, we want to have some sort of aspect that they understand there's an ADHD component to it that's
Right.
affecting, our behaviors and thoughts, but it's not the pure the CBT protocol that's typically
Right.
done.
Right.
So,
There's got to be that executive functioning, issue. I mean, the
right.
other stuff is still there, but it's embedded with that. Like somebody asked me once on Twitter, um, are the skills separate from the CBT? And I said, yeah, I thought it was a great question. I said, no, they're embedded. I mean, they're part of it, but it's tied in with, it usually starts with the thoughts about the tasks that we're doing or not doing. But
Mm-hmm.
then that can also lead into how
Hmm.
we are not what we do for a living. We're not our salary. We're not our degrees behind our
Yeah.
name, if we have any, but these are not nothing, pardon the double negative. These are the thing about ADHD and the executive functions and what can be so corrosive about it. It gets in the way of the things that people have set out to do because presumably they want to do it. And it could be doing homework to get credits for a class
Yeah.
to graduate. It could be taking out the recycling so it's not overflowing next week. But it's also other things that are more personal, tied in with sense of self, or entrepreneurs
Mm-hmm.
invested in a startup or an own business. It's really personal. So yes, we don't want to be defined by it, but let's not say that, okay, I can live without any of this stuff and just be at peace on my own. Hopefully we could, and we can
Yeah.
be at peace along the way. And it could be a bumpy journey, but also to know like these things are worthy of attention. So that's part of what gets how the CBT gets woven into the executive functioning ADHD piece.
I think that's a huge connection there because to me, what I'm hearing and what I'm feeling, what I'm remembering back then is it was actually my executive dysfunction that was causing my negative thought,
Yep.
not the negative thought popping up in my head.
Right.
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 And then the
You
cognitive
don't.
biases will get in there and just start
Right.
squirreling everything away to feelings to
Right.
now behavior.
Nobody thinks themselves into having ADHD. And even I know in the early writings, there would be the thoughts cause feelings, cause behaviors. But, I had occasion to ask Dr. Beck one time, what's the biggest misconception about cognitive behavioral therapy that's out there? And he said that thoughts cause everything. Feelings
Yeah.
can come first, and there's other ways to process information. Thoughts are a useful entry point. Hey, what are your thoughts about studying tonight?
Right.
But it just because that's a good starting point doesn't mean that's what started everything. It's
Well,
just
it's
a useful
circular.
entry point. Yeah,
Yeah. It's
absolutely. Oh
circular.
yeah,
One can be coming,
absolutely.
but it follows the same circle no matter
I,
what.
I I always like the phrase. I forget. It's a braided cord. It's a braided
Yeah.
cord.
Very nice.
Yeah.
Well, thanks again, Russ, for sharing this CBT. And I'm really glad we got to talk about this because to me, it was a good experience, but at the same time disappointing. So in a way, negative. And until someone told me it was kind of different, not specific or
Mhm.
modified for ADHD. It made a big
Right.
change. And I want people to understand the differences. And if you did go through CBT and felt it was a waste of time, well, maybe you're right. And now we know what to do or what to look for,
Right.
and there's nothing wrong with it. And so thanks again.
You bet. Thanks for having me, and thanks for having this broadcast. I'm sure this podcast. You're helping a lot of people.
Thank you. And to you, the listener, are you interested in CBT? I know I had a great success, and I would like you to seriously consider it because it does help with a lot of cognitive biases, how to deal with your thoughts, and in a way, it really helped me shape different behaviors. So, to you, the listener, thanks again for listening. We'll talk to you soon.